And it looks like we're live. I'm just going to wait a few seconds because on Facebook, there's always a bit of a delay. So we'll just kind of make sure it's all working. It looks like we're good. Hello, everybody. It is Live with Tammy, and today we have a very special episode. I've got a couple guests with me today, but before I introduce them, I just want to introduce myself if you're new to me. My name is Tammy Dunnett. I've been nursing since 2006. I worked the H1N1 outbreak in Winnipeg in the ICU, and I currently work the SARS outbreak here in Edmonton, Alberta, in public health. And I'm also a communication coach. And for me, the primary purpose of bringing this team together, who I'll introduce shortly, is to give you some more information so that you can engage in healthy conversations and maybe decrease some of that disconnection that's happening and getting back to supporting each other. So we're going to be talking about COVID passports, the workplace, and you. And to help me with that, we have Teresa Kiyawasew. She is the wonderful wizard of HR, and she helps small businesses who do not have in-house HR go from feeling uncertain and vulnerable and inexperienced in human resources to confident and knowledgeable so they can concentrate more on the business, spend less time researching and troubleshooting how to navigate through HR. Welcome, Teresa.
Thank you very much for having me, Tammy. I appreciate it.
Yeah, I'm happy to have you here too. I'm excited to hear what you have to say. I know there's going to be a lot of questions for you. And also joining us here is Sam Johnson. He is a lawyer practicing in the province of Alberta. His primary areas of legal practice are civil litigation, real estate, corporate, and commercial. He's been married to Michaela. She wants a shout out here. She sent this in on your behalf, Sam. Michaela, yeah. Hey girl, she's one of my students from before. They've been married 7 years, and she's now nursing in Alberta Health Services, and they have 2 beautiful children. Welcome, Sam.
Thanks. Yeah, I'm happy to be here.
Now, for those of you who are joining us, we are streaming live into Facebook, YouTube, and LinkedIn. And if you're joining us live, you can join in on the conversation by sharing those comments with us. Just give StreamYard permission to allow them to come in, and we can all see and share those here. So before we get started, I think these last 18 months have been hard on everybody. And I know healthcare providers get a lot of acknowledgement for all the work they're doing, but I just want to celebrate everybody who's been on the front line, behind the front line, supporting people at home in terms of getting us to where we are today, because it has been no small feat to accomplish what we've accomplished. And just the most recent stats are that we have 78.8% of Albertans with their first dose. That's an amazing immunization rate, with 71% fully vaccinated. So we are doing great work. And we're going to be talking about vaccines, workplace, passports. So let's just dive in. I think one of the first questions that's coming up right now is about mandating vaccines. And how's that going to impact people? We have this impacting employment. There's potential loss of employment being shared by employers. There is limitations to travel, limitations to services if you don't have evidence. So why don't we start with the concept of mandating vaccines? And I'm not sure which one of you wants to start on that topic.
Well, I could jump in if you don't mind, Teresa.
Not at all. Go for it.
Okay. Well, I think that in some workplaces they're already required. I know for some nursing jobs and medical professions, you have to have all your vaccines be up to date, and they won't look at you or consider you or allow you to start working until you are up to date. It may be a bit of a different question if you're already working and they never had that requirement before, and then they decide that they're going to implement it, especially in situations where people may be working from a very specific contract. That kind of thing could be a bit of an obstacle. But in terms of whether it's a possibility, I think that it is. That's my personal opinion, because it happens already, and private employers are allowed to have whatever requirements they want for a job, essentially.
Mm-hmm. Well, I find that interesting. I was looking up the Alberta immunization record. So for the audience, we are all Alberta based, but a lot of what we talk about will still apply throughout Canada and maybe even globally, just in terms of the general concept. But some of our stuff will be very specific to Alberta. So I was looking up, because you hear comments about, well, your kids had to be immunized to go to school. And it's a yes, but situation. So we have a schedule of immunizations that is recommended, but there are exceptions. So if there's a measles outbreak and your child did not receive that immunization for whatever reason, then the exception would be that we would protect them by removing them from that potential source of infection. So I don't know if it's legally required that you have these immunizations. It's strongly recommended, but I couldn't see the language where it was legally required for schools. I do know workplaces are a little different, but I wanted to throw that in there because it's part of the conversation that's happening. As evidence that people are saying, yes, but your kids had to be immunized, but I don't think that's quite right in Alberta. And maybe it is legal in other provinces, but just throwing that in there to the mix because I know that's one of the reasons people are debating it.
I do want to talk about the part that you just mentioned about your kids having to be immunized. I know that just from personal experience, this is not my professional opinion, but from personal experience with both my children growing up in the public school system, it was a choice. Again, we had to sign off on our children getting immunizations at school or at a healthcare facility, and they weren't turned away. If from what I understand, if you're not going to get it, I don't think they're going to turn you away. But I do believe that now we're a little bit more hyper aware of how to protect our employees or students in that case from possible issues, like from a safety perspective, and I think that employers having one mandate or one policy, because as you mentioned, you couldn't find anything legally, because I don't think that there has been anything legally that has been, received royal assent, I guess. So when you look at employers, what they're going to be doing is they're going to be having policy that says this is what we require, but I don't know that it would cover everybody. So then what's the next step? Especially like what Sam said, those are for new employees arriving, but what about existing employees? Do you let them all go or do you keep them around? So the situation there is, okay, well, you have to be a little bit more for that. Would you say there were 71% that are fully vaccinated for the 29% who don't fall all in the same bucket? There are people who choose not to, but there are people who actually just can't. And for those individuals, or some where vaccines just don't take for them, their antibodies don't build up. So what are you doing for those kind of individuals who are maybe already existing in the workplace? And I think that's what employers have to do. They have to look at a broader, larger picture for that.
Yeah, I think a lot of the reason why we haven't approached this before or dealt with this before is, at least my understanding of in school is it's more of an opt-out situation. We're going to give vaccines, everybody is coming down at their allotted time slot and they just start, giving the shot, but you can opt out. And I think you get a lot higher rates of acceptance because there are people that are on the fence or they're just apathetic. And if you get 90% of people going through and getting vaccinated, then that may be fine to just leave the 10% that are strongly against it. Then that may be fine because 90% is probably enough to develop herd immunity in most cases. But in the case where we've got something brand new and people have to opt in, there are a lot of people that aren't getting caught in that net that normally would get captured by just a feature of the decisions almost made for them, and they don't have strong feelings for or against.
And I think that brings up a good point of autonomy. So, and I think this is getting lost a little bit in the fatigue of healthcare workers and just everybody in general. We're starting to hear now people say, this isn't just for you, but what about the person who's sitting beside you? But what I do for my body isn't about them. And so there's almost this shame and guilt, I think, coming from our political leaders now about this is for the people beside you and you have to prioritize them over you, when we're kind of losing sight that people have autonomy. It's called informed consent. And what goes into your body is your choice. And I think there's a lot of concern that freedom of choice is being taken away. But as you mentioned, if you were to give them the option, we would probably have some of those people lean more towards taking the vaccine just because they got to make that choice.
Yeah, I'm thinking specifically of, I think it was Germany maybe, or Switzerland, and they had an option on the back of their driver's license where when you're filling out your form, you can check a box that says, yes, I would like to be an organ donor. And they had, something in the 20% of people that were checking that box to opt in. But when they changed the box to say, check this box if you would like to opt out of being an organ donor, the numbers just skyrocketed. And people, I mean, it's not like that they had strong feelings one way or the other, just sometimes people don't want to make the decision for themselves. They're happier to let somebody else decide for them.
That's a very good point. It's all perception, right?
Yeah, and on that point about perception, I know that this has become a really divisive topic, and I think it can start with just the language that we use. For example, vaccine passport versus immunization record. They both mean the same thing, but they kind of invoke different ideas. Like the vaccine passport feels very restrictive and a cumbersome responsibility that you have to take on. But if you call it an immunization record, people will, if you ask somebody, are you up to date on your immunization record? It's almost, you might get defensive if you're not. You might say, oh no, I missed something a couple years ago. I need to get in there and do that, right? But if you say, do you have a vaccine passport? People might be the exact opposite and say, no, I'm not going to let the government control what private information they store about me.
Well, that's such a great point. And I was thinking about these apps. I don't know if you guys had ever, okay, one day I was trying to not pay for parking downtown. So I had the app open. I thought I'll just read everything before I agree to it. It's actually quite scary how much power they have over your information that you put into these apps. And what I'm seeing is these QR codes, these apps are coming out now that are going to carry your information. Now in Alberta, we don't have that. What we have right now is that you can go onto my health records and take a screenshot or download your documents to show as proof. I don't know if all provinces will accept that because BC just now announced a vaccine passport. Saskatchewan has it, Ontario, New Brunswick. No, Nova Scotia just announced they were going to start using that as well.
Mm-hmm.
But we're hearing stories of people who have their proof being denied entry into places because it's not the passport of that province.
Okay. It's not just any proof. It has to be the certified proof, the certain forms.
Yeah, and I think we're going to have a bit of a growing pains there, but just the whole concept of passport, we're already seeing those limitations show up, right? And organizations are like, and maybe you guys can speak to this, but organizations are already saying, how do I police this? And I think, what do they do when they get an unruly person in the hospital? We have security. But when they're out there working 7-Eleven and someone wants to use the washroom and they have to deny that right to somebody,
yeah,
who's going to pick up, who's going to protect them? I think there's a lot of issues there. But what are you guys seeing in terms of workplace and concerns or logistics?
Well, I can start if you
sure,
want.
Yeah.
Okay, so with some of my clients, this is a big concern. There are individuals who it's actually flipped two ways. And first, it used to be just mask mandating, right? We're going to mandate masks. And people were like, we don't want to be told that we have to wear a mask at work. And that has kind of subsided a bit because now there's the thought of mandating vaccines. And so, I don't know, the masks have kind of gone to the wayside because this is a bigger beast, I guess, because now this is not just what you're putting on your body, it's what you're putting in your body. And they're starting to wonder, and unfortunately, there isn't enough cases, there aren't enough precedents set, not just in the legal side of things, but from policy, just strictly what the common practice is in organizations. There's just not enough information. And when we try to relate it to something else that we've mandated before, nothing really fits the same mold as vaccines, right? So very uncharted territories. And some organizations, they're taking the risk. large organizations. From what I understand, TTC in Ontario, the Toronto Transit Commission, has mandated it. And now grievances are going to start, right? Because they're unionized.
Mm-hmm.
And that's where the grievances start. And that's where grievances, they could win, because there's a human rights factor. There's all these other pieces, constructive dismissal, all of these other pieces that come into play. But all this fear and all of these unknowns, some people are, and you see this in anything, it's the element of risk that you want to take, right?
Mm-hmm.
I know what my risks are, or maybe I don't, and I'm going to go to the top of the tower of risks, right, for lack of a better analogy. And others are going to say, I'm not taking that risk, right? I need my employees. Right now, we're in the great resignation. People are just leaving. They're happy to work at home. They could care less if they stay. And I'm going to be stuck. And I've already been stuck for the past year and a half as a small business, let's say. So like all of these factors come into play, and it really is like walking on glass for a lot of these businesses, in my opinion.
Yeah, and I think that the government is just letting them do it in a lot of cases. I think they're banking on the domino effect that you just mentioned, about how people were they would throw fits about masks, but it's been a little bit of time now, and people have warmed up to it, and it's a little bit old news, and they'll do it, and it's not really invasive. But the new thing, like you said, it's vaccines. It's more invasive, and we don't really have any kind of a precedent. But I think the government wants private practice to start with their implementing mandatory vaccinations. And then, other people will start to do it. It'll become a little bit more normal and more culturally acceptable. And then governments can start mandating it, or maybe starting in schools and that type of a thing. And then just gauge it from there and see how many people are compliant, how many people are resisting at all costs. They'll quit their job, they'll move, whatever they need to do, change school districts. And if we reach acceptable numbers of vaccination and the COVID virus is essentially eradicated, then I don't think we'll see top-down government mandate everybody must. But I think we'll have to wait and see, kind of a thing, and they're just letting the time pass by till people cool down. I think we've seen this before with seatbelts. When seatbelts became law, people were protesting that, and same thing with smoking. Smoking's kind of like wearing a mask or taking a vaccine, but it's the exact opposite. And people were having protests about that as well, about whether it was their right to make that decision for themselves. But eventually it dies down, and I think the more outspoken people come around to what becomes culturally acceptable.
I think the fundamental difference, though, is seatbelts aren't something you're putting into your body.
Right.
Smoking, you still get the choice to smoke, but you have to just do it over there. There's no, you get the choice to get the vaccine, but you just have to stand. Like, there's that fundamental difference that this is something that you have to put into your body to fit into society now.
Yeah,
so
it's a lot more invasive.
Yeah. And to your point about how the government's kind of just letting private organizations, and I think private organizations are taking the lead on vaccine passports, because I believe they have a duty to protect the worker as well. So there's a lot of talk about us having to show our passport when we go into restaurants now or into the gym. But I haven't heard any talk about the flip side, are they having to show us their passports?
Right.
Do they have to post those to let us know? And I think of that because of what happened to the Edmonton Elks just recently, where they had to shut down their season for a while, and not all of their players are vaccinated, but they mandated that every person who came in had to be vaccinated. So are we playing with two sides of a fire here?
I think as long as it's not regulated, it will be. It'll be whoever wants to and whoever mandates it. And, the downside to government is that they take a lot of control, and they're probably inefficient, and they're too big to really cater to everybody's individual needs. But the upside is the same thing. I mean, they can make a blanket requirement for everybody, but in private practice, it's unfortunate, but the way of the world is that the people with the most power can make the decisions. If you're the Edmonton Elks team and you're the draw and you're the reason why people are paying tickets, and you won't get vaccinated, well, maybe the organization will say that's okay because it's only X number of players versus everybody in this stadium. I think as long as it's not regulated, that will continue to happen. I'm a big fan of the NBA, and I know some of the premium players have refused to get vaccinated, and that'll just be the way that it is until they're required to.
Well, and I think when it comes down to that, there really needs to be a backup plan, right? If they're going to say no, my body, my choice, or whatever it is, that whatever the reason is that they're not getting vaccinated, or maybe they can't, for who knows, for health reasons. Mm-hmm. I think that there is a duty to whatever organization there is to have a backup plan, to say, okay, well, if you're not getting vaccinated, this is the next step. We will be doing regular testing. You will be required to wear a mask. We will be cleaning your area, right? Like we will still keep the safety protocols top notch for everybody. Mm-hmm. But you will have a few extra steps that you will have to take as an unvaccinated person. You will have to keep your distance. And, there'll just be a lot more for that individual to do. I think that there should be. I don't think it should be you're either this or you're not, right? Especially like you said, in the NBA, you're talking about the top players who are refusing. They bring in, like, they're the entertainment. Yeah. Right? They bring in the money for these organizations. And so they do have a lot of power, power shifts that way for them. Right? So the organization has to come up with a secondary, and that goes for a tiny, small little business too, right? You need to have other measures in place. It can't be just this or that.
So would it be fair for a patron to say, here's my passport, can you show me yours?
I think to some extent, especially when it comes to the government anyway, like if you get pulled over and they request your ID, you're entitled to ask for their badge number or some type of identification, and they've got to give that to you. But in private practice, you're allowed to deny service to anybody, and I think that you may be able to deny that as well. Whoever has the power gets to make the rules. And in employment situations, unfortunately, the employer generally has the bulk of the leveraging and power in that kind of a situation. They could deny or decline to provide that proof.
So would that be considered where the legal authority lies, is actually with the employer, or is it at a higher agency?
Sorry, what do you mean?
So like, who has the legal authority to require that you have a vaccine?
Well, I think an employer probably could. Like I said, this is my personal opinion. Just like, for example, Alberta Health Services, they can say, we won't hire you until your vaccine record is up to date. And that's the power of the employer. An employee could come in and say, I will not work for you unless you let me work without an up-to-date immunization record. But they'll probably just ignore them. They don't have the same bargaining power that Alberta Health Services does. And I think it'll come down to it in private practice in small organizations. Sometimes the employee can bargain for that, and sometimes the employer just has all the power.
Yeah, the Canadian Nurses Association and the Canadian Medical Association have actually are lobbying for mandating vaccination for COVID. Obviously, that's not new news, but this is new territory because those annual flus that come around and viruses have never been mandated before. It's always been choice, and if you didn't get it, you would be organizationally managed. So if there was an outbreak on your unit, they would have you go work in another unit until it was clear to bring you back and it was safe. So there was that duty to accommodate and duty to protect, but now we're seeing it at a different level.
I think that there are, like, in certain situations, there are occupations that I believe are bona fide, right? That their need, when it comes to human rights anyways, right? You have a duty to accommodate to a certain extent. And then when it becomes where there is actual danger to someone else's health or well-being or safety, that's where the bona fide occupation comes in. And that's where, employers have to look at that and even work with human rights to say, listen, I believe that the health, or, I would say it's human rights in the public sector as well, right? And so how it would work is you ensure that these particular types of positions are, you no longer have this duty to accommodate the employee. You have a duty to protect the patient, right? And that's where, I think that's where they come in and say, as a healthcare provider, you're the front line, you're working with these patients, they need to be protected. And we have to make sure that, number one is safety. And that's where the vaccine comes in.
Yeah, I think inevitably you're going to have competing rights. Some people may say, I live in a free country, I have autonomy over my own body, I have freedom of expression, association, all that stuff. You can't make me do something that I don't want to do. It's my right. And that may be true, but what do you do when your right infringes on somebody else's right? If you say that I don't want anybody putting anything in my body or mandating anything in my body, that may have an effect of infecting another person. You can kind of think of it like a sliding scale. At least that's the way it was explained to me. But the more a law interferes with someone's rights, the more scrutiny courts and legislation are going to give it when they determine whether it's reasonable or not. And if it is reasonable, then they'll allow it. But if they determine that it's not reasonable, then they may say that it's unconstitutional. Just for example, we've got the freedom of religion in Section 2 of the Canadian Charter of Rights and Freedom. But Section 7 also gives every Canadian the right to life, liberty, and security of the person. And so you've got religion and your right not to essentially get hurt. But there are some religions that have practices of, certain practices that could be viewed as physical harm to children. And that's just part of their religion. So the one that I'm thinking of, for example, is there are some religions and they practice female circumcision. And if I understand right, I'm not a criminal lawyer, but I think that's against the law in Canada. But there are other religions that practice male circumcision, and that's not against the law. And somewhere along the line, the courts have decided that our culture is one that allows one and not the other, which is kind of a bleak look at the way that we treat men and women, but it's a realistic one. And I think when the right of one person infringes too much on the right of another person, that's when the courts need to step in and make a decision.
Yeah, I think that's a really good point. Safety trumps your right to freedom of speech. We know that you can't go around doing hate speech if it's harming somebody else. Their safety always trumps those trespasses. It's a really good point. So when we come back to, I'm going to just pull up some of my notes here. And if there's something else you guys want to add there, feel free to jump in. You made me think of something. I'm just trying to find it here.
Yeah, one other thing, I don't know if I'm jumping too far back here, but in terms of mandating it, I just think that it's kind of ironic. I think, Teresa, you were saying that before we haven't mandated flu vaccines or required flu vaccines, we just had an acceptable uptake. But it's funny to me now that there are people who are really outspoken against a mandatory vaccine. And I've heard it said they're not against vaccines, they're against government control, which I completely understand. I think that the government is inefficient and they often make poor decisions, and they don't know me, so why can they make decisions for me? I totally understand that, but I find it ironic that the resistance is kind of forcing them to make a decision. Whereas before there was enough uptake in vaccines that they didn't have to worry about mandating a flu vaccine. But now this active resistance and the persistence of the COVID-19 virus. It's pushing us to having to make a decision, which I just think is kind of ironic. They're the authors of their own fate.
Well, there's a comment here about PPE and good hand washing and screening was good enough for 18 months, but suddenly not now. Vaccinated people still carry viral load as well. And I think that just kind of counters your point, and can infect as well, which is so true. I mean, we know that past history tells us the influenza virus always mutates, it always changes. We're seeing the same thing here now with the variants of COVID. That's not unexpected. But we also know that even though you're vaccinated, that doesn't give you superhuman powers. Vaccines save lives, but they don't prevent you from getting the virus and transmitting it. And so that is the reason why we are still in these conditions of masking and locking down how many people you can hang out with, depending on where you are in Alberta or in the country. Mm-hmm. But just to share that point there, because it's kind of like a why was it good enough then, but now we have to do more comment.
Yeah, if I can respond to that, I don't want to get too argumentative, but my perspective on that is I don't think it's so much that, hand washing and everything was good enough and now suddenly we need vaccines. I think from the get-go, it was a race to get the vaccine and it just wasn't here yet and it wasn't safety approved. And I kind of think of it, I think the analogy of seatbelts and driving a car has been beaten to death, but it's just a good one. Maybe you're driving a car and you have to wear a seatbelt and use car seats and everything, but now suddenly airbags are mandatory. It was fine before. Well, yeah, that may be the case that we did everything we could before, but now that the airbags have gone through the proper safety testing and we know that it's not going to blast you out of your vehicle and cause more damage than harm, now we can say, all right, let's also apply this safety measure in addition to those other safety measures.
And you'll even get resistance on seatbelts. I mean,
Even
there are still
right?
Today you get resistance on seatbelts. I mean, you get resistance in a lot of places. Some people just don't, it's just don't control me. Don't tell me what to do. Let me live my life. Right.
Yeah.
But
And I totally understand that.
Yeah. And there's a lot of rule followers. I think where I think we get caught up, when we try to compare to the flu, this is a pandemic that spread rapidly around the world. So everybody has been extremely reactive, even though from what I understand, and I'm not, I haven't been following this for a lot of years. I know SARS, there was breakouts before. And from what I understand, vaccines have been something that has, been in play for quite a while. It just wasn't where it needed to be. And COVID pushed that into like hyper speed. We've got to get this now, right? But I mean, I guess where I'm getting with that is, yes, 18 months ago, that was all fine and dandy, and we had to do what we had to do, and now all of a sudden vaccines are important. To talk to your point, Sam, people were developing it, and then it became safe enough, and it had to be done quite rapidly. I still think good PPE, good hand washing, all of that stuff, I don't think that should go away. Like, I think that, and I know Tammy and I have talked about this offline with her son saying, I got these vaccines and now I'm told I still have to wear a mask. That's not fair, right? But at the same time, there's still a percentage of a small percentage chance of you either contracting the virus or spreading it. But it's so small now because you're vaccinated, right? But I do believe in good PPE and good hand washing and all of that stuff. Keep your distance.
Yeah.
Anyways, I kind of went off the rails there. Did you find your thing that you wanted to talk about, Tammy?
No, I got so many notes on my page from earlier. And that's so true. I think that the fourth wave and having to go back into restrictions is, for some people, creating more tension because they thought they were doing the right thing before by getting vaccinated when they wouldn't have done that originally. Like, they wouldn't have normally jumped in line to get the flu shot, but they morally felt, okay, I'm going to do my thing and support the country, and I'm going to get vaccinated and be part of the solution. And so now for them, it's creating some dissonance as to, well, I did that and it didn't even get me what I wanted. It didn't give me the result they promised. And I feel like that is contributing to some of maybe a lack of uptake for those people that we would have had get the vaccine. Personal thought there. I mean, obviously, now that they've made it mandatory, we've seen an uptake in people getting the vaccine for their jobs, but I don't think they would have got it otherwise.
Jobs and travel. I think those are the two key things. You know, people want to go from province to province or even eventually outside of the country.
Mm-hmm.
And that's driving a lot of, you know, why people are getting vaccinated. That's not the only reason, obviously, but, you know, those two things. And now with the job situation, yeah, you know, people need to support themselves.
Yeah, I think that there are a lot of, I'm curious to see where, you know, where the scale gets tipped in a lot of situations. When do we see another big spike? Because we've seen a few incentives and, you know, in Alberta, the $1 million lottery, and maybe there was a little spike from people hoping to cash in on that. And now there's, I think, $100 prepaid gift card if you get the vaccine in this 6-week window. And I don't know if we have any noticeable increase on numbers after those incentives, but, you know, I think when employers start mandating it, we may see an increase. When travel is very clear that you need this immunization record in order to travel, then there may be a bump for other people. But I think the big one will be when people face the risk of not being able to support themselves at their job. I think that will be when people really are unhappy and they feel forced to do it, because you don't have to go on vacation. You don't have to go to the football game and that type of thing. And it's more of an opt-in. But when you feel more forced to, as opposed to taking advantage of a luxury, I think we'll see an uptake, but then I think we'll also see a lot of upset people.
Yeah, there was actually read an article today about COVID passports being required for the unnecessary, the luxuries of life, going out to the restaurant, going to the gym, that kind of stuff, attending concerts. But there was a concern on the flip side, and I often wonder how far do we look into the future as to what this might be for ramifications, and that those who are unvaccinated, they will still gather. They're not going to just stay at home. They will just gather somewhere else. They'll stand outside the stadium and listen to it, but they are still going to gather. But the other thing is it might actually increase other comorbidities. So, for example, the gym. For people who have mobility issues, but they can't get the vaccine, now they can't go to the gym anymore to take care of that part of their physical health or their mental health. They're being denied these services that would keep other parts of themselves healthy. So I wonder about the future and how all we had the mental health crisis now coming as a result of the last 18 months of isolation and restrictions, and what other crises are going to come as a result of this now. I don't know.
I think you hit on a really good and important point there. The last thing that we want to do is create a two-tiered society. And I think the gap between top class and you know, like the top 1% and the average median income family, I think that gap is definitely widening. And the last thing we want to do is push that further. And I'm pretty sure, I mean, it's not my area of expertise, but I believe that vaccination rates are lower in low income, low education, and marginalized communities. And if we mandate it, then that may just further disenfranchise those individuals, the people that have decided that they don't want to for whatever reason. It'll just increase that disparity. So I think that definitely needs to be addressed. And I think resisting those mandatory requirements for as long as possible is definitely the right decision. I don't think that we should jump into it, because it could have negative effects on people that already suffer against a system that's stacked against them.
And accessibility. I mean, not everybody lives in the urban centers where they can get access easily. Yeah.
And that kind of leads to Tammy, do you mind if I posted earlier that we will be going live and asked if anybody had any questions or comments, if they could just let us know ahead of time. And we have one here from Karen who says, I'm very excited to hear what your panel has to say. I would love to know what is being done for someone who has already survived COVID, has natural immunity, and chooses not to get the jab. So I think from what now this is not professional or anything, but from what I've heard, your immunity only lasts so long. Is that correct?
I don't think they have long-term evidence because COVID is so new. And so what they show in the studies, what I saw today is maybe 3-6 months, they still show really good immunity. We don't have that long-term data yet to support not needing a COVID shot. If you think of tetanus as every 10 years, when we got our hepatitis B, it's multiple shots. So sometimes for immunity, we need to have those boosters in order to protect us. So I think that's what they're going with right now in terms of we don't have the data to know. So the COVID shot is your next best defense, even though you've had COVID.
Okay, so in a situation where they've already had COVID and they can't get the shot for whatever reason, adverse reactions or something along those lines, I guess, what is happening to those individuals?
I think they're still at a wait and see. I haven't been able to find too much documentation today in terms of the immunity passports or COVID passports or immunization records to show that they're considering serology as one of the reasons to give you the freedoms of movement. So I'm not sure what they're going to do with that yet. I'm not sure if you've seen anything in the law area and the legal side.
I really haven't. No, I think that we'll get there, but right now it's just such a small minority, and it's too fresh, too new to really know. I mean, there are no 5-year studies on COVID yet, so we can't know. So I think we'll get there.
And it gets me wondering that for those individuals who need those passports, whether it's for work or for travel, and they can't get the vaccine for whatever reason, and their doctors are aware of this, does a doctor's note suffice for them? You know, that's a question that's out there for that, as you say, this small minority of individuals, but they're still human. They still, want to live their life, but there are things that are preventing them from being able to do those things. So do they just remain isolated and their mental health is, it goes to the wayside? Like I just don't, I don't know what they're going to do for individuals who have valid reasons why they cannot get that vaccination, and if a doctor's note will suffice for them.
I think they're still hoping for herd immunity. That benchmark has changed though, right? So initially it was a lower threshold that we needed to have in terms of percentage of population immunized. And now with the Delta variant, it's come up higher because of just how infectious it is. So the benchmark has changed for herd immunity. And until we get that, I don't think we'll have that full freedom of rights for everybody who's unable to vaccinate.
So the vaccine passport is only for those who are able.
Who have been vaccinated.
Who are able to get vaccinated.
Yeah. Now the UK,
Right.
actually, I saw an article for the UK that they talked about immunity passports and using serology. I didn't get through all of it and it wasn't relevant to Canada, so I didn't really focus on that as I was preparing for this. So I suspect that there's probably something in the works about serology and immunity, but we don't know again how long it lasts. So maybe if it's in the first 6 months and you have to travel and you have your serology, they'll accept that. There may be some caveats that come out to delineate.
Oh yeah, I just met a gentleman who came from Switzerland to here, who had COVID and used his antibody testing. I think that's what you mean by serology.
Yes, yeah.
I'm not in the healthcare world, but I'm assuming. He was able to use that as proof for him to fly here from Switzerland.
Well,
so I guess that maybe is, I forgot that I met him on the weekend and he told us that. Yeah,
that's awesome. So that means there's movement there, and our borders are open, but does that mean the other borders are open to us if we don't have it? That's, a bigger question.
Mm-hmm.
Yeah, this is just making me think also about, if you say, for example, aren't wearing a mask for religious reasons, a private employer, they may deny you employment, or maybe a grocery store will say you can't shop in our grocery store without it. And there's nothing that supports the decision directly about a vaccine, but could that be considered a human rights violation or a constitutional violation because it's rooted in their freedom of religion and they're being discriminated against based on their religious beliefs? I'm sure we'll see those types of cases play out, but as it stands, I'm curious to watch how that unfolds.
Oh, that's a very good point too.
I'm surprised we haven't seen anything yet, to be honest.
Right.
With, you know how vocal there are certain people, I don't like to use labels, anti-vaxxers are what they're called, but I mean, they have, I don't want to lump them all in the same boat, but there's a very vocal group of people who are against vaccinations, against being told what to do. I'm surprised that we haven't seen something come forward yet.
Yeah.
Well, interesting discussion. Go ahead.
I was just going to say, I feel like I've been pretty one-sided. I'm not really hiding the fact that I think that it's a good idea to get vaccines. I have said it a couple of times. I totally understand the hesitancy to get the government involved. I think that there are some very real concerns. I know that in BC, I believe they have a province-based insurance system. And so what are we going to mandate or require when that information is given to the government? Are we going to say that they can't share it with anybody, or will it be reasonable for them to share it with individuals? My reference to the insurance company is, what if you're not vaccinated, so they could deny a life insurance claim based off of that? And is this information going to be sold, and to whom? And knowing that kind of stuff really does happen, I think that's a legitimate concern. And even if they don't want it to get out, then it still may. I had a marketing call not very long ago, a month ago, and I asked them, where did you get this phone number from? And he told me, I'm not allowed to give you that information, which I thought was ridiculous. He wasn't allowed to tell me where he got my number from, which was a red flag to me. I'm sure somebody that I signed up with somewhere sold my information to this company. But yeah, it's a real concern, and I definitely don't want my information getting out there. But on the flip side, I've got a driver's license, and all that personal information is already stored somewhere. So,
and a cell phone.
Yep.
Even your cell phone. I mean, there's.
How do we support people in the workplace in terms of, because this is really crazy times for everybody. People don't know if they're going to have a job tomorrow. They're going to have to disclose their medical information to keep their job. There's some concerns about the Privacy Act in terms of, this is my medical information. I shouldn't have to disclose that. I don't have to tell you. Like, if I were working in the hospital and I had another disease, hepatitis, I would have to tell my regulatory body, but my employer doesn't need to know. My colleagues don't need to know. My regulatory body would put limitations onto the places I could work. And that's all the employer needs to know. And so now the employer is actually wanting to know these records of your immunization status in order to make sure you're safe to work somewhere. So I feel like this might be opening up Pandora's box a little bit, because there's things I don't have to share, right? I could have HIV and nobody needs to know except for my regulatory body. And they would make sure I don't work in a place where I could harm patients.
Yeah. I think that, just like with anything, because this is new, the first one through the wall is always going to get bloody there, and then they'll make a decision based off of that. And like, somebody's going to have to disclose their information, and then 10 years from now, we'll look back and say, oh, that was totally wrong. We should not have done that. We should have just known that this path was much more reasonable to go this route. Well, my favorite kind of advice has always been time travel, but since we can't do that, we don't know what's going to happen or what will become obvious in the future. But we're just trying our best, and some people are going to really be mistreated, and some people are going to sue and be successful, and some people will lose their jobs and never see anything because of it. It's Pandora's box, and we're going through it right now and just hiding.
Yeah, I would say my advice to employers, as far as employee treatment is concerned, is and I've said this for 23 years in HR, is if it doesn't feel right, don't do it. Right. And if you can, in my opinion, if you can get the same results by doing something that will not harm your organization or your employees, then go with that. So really, they really need to weigh the pros and cons of the direction that they're going in and make as much of an informed decision that they can. I think if you're going to go all willy-nilly or just, say, hey, I'm just screw it, I'm going to treat everybody with, exactly the same, everyone's cut with the same cloth, and you're all going to be, this is mandated, and from now on, this is what we're going to do, without really, really looking at a contingency plan or, like just I believe that you have to have strategies in place, and you have to really dial into what it is that you want from your employees, for your employees, and for your organization, and what kind of employer you want to be. Because that is going to reflect in anything, and not just your employees, but your customers, your clients. What are you going to mandate from them? How are you going to, anybody who comes in and out of your business and interacts in a way that COVID could be spread, how are you going to treat everybody?
Yeah.
And are there going to be different levels, different scales within your organization, depending on the position as well?
Yeah, I actually, now that you're talking, I have heard of some strategies that certain employers have implemented. Just one specifically was, maybe first you have to determine what decisions need to be made. So like you said, if you're going to just jump the gun and mandate it for everybody, well, you may not need to go that far at first. I've heard of some employers doing anonymous surveys, and depending on the size of the organization, that may or may not be practical. But if you do an anonymous survey and you ask a handful of questions, you may find out that only 2 people out of 100 in your organization are refusing to get the vaccine, and then you can make the decision: is that worth making a fuss over, or are we happy to continue with these percentages? If you take the same survey and maybe half of your organization refuses, that may be a problem that you need to address directly. But if you, for example, say you have a small business and it's 10 or 12 people working for you, and everybody's decided that they're double vaccinated and they have been for a long time, and they practice a lot of hygiene habits, then maybe you don't have to impose so much on customers that come in, that type of a thing.
Well, now you've just flipped me to the other side a little bit, I've got to tell you. Because being in healthcare, we have patients lie to us because they want to make sure they get their specialist appointment. And it happened in an ECG clinic I was teaching in. They had a patient come in, did his testing, he left, and the doctor called and said, hey, did so-and-so show up for that appointment? Yep. I told him he couldn't go because he's COVID positive, and I told him to cancel. So when he came in, he said he didn't have COVID. And so we rely on the morals of everybody, don't we? Like that's kind of how this whole world has been up till now. We rely on people's good morals to go and get vaccinated, do the right thing, stay home when they're sick. Doing a survey, you're still relying on their good morals, and we can't always trust the results, apparently.
Yeah, and even if we have a COVID passport, people are going to be counterfeiting it, and that's already been happening. So
absolutely,
so many places we can go with this discussion. Any last words, and then let people know where they can get a hold of you guys. We'll start with you, Sam.
Well, I wouldn't be a lawyer if I didn't give my disclaimer. This is all just my personal opinion, not legal advice. So
you should have started with that.
I should have, yeah. Take it all with a grain of salt. I hope you're all still listening. Also, my wife is in the healthcare industry, and I have 2 little boys. So it's a high risk zone, and also not high risk, but children can't get vaccinated. So that informs my position, I think, significantly. But yeah, like you introduced me at the beginning. I primarily do civil litigation. Probably don't reach out to me if you've got a constitutional rights claim or concern. I mean, maybe I might be interested. I'll dive right into it. But yeah.
Something new and
Pandora's box.
exciting.
Yeah.
Yeah, exactly.
Awesome.
But other
Where,
than that, thanks for
where
having
can
me
they
on.
find
Yeah.
you?
Oh yeah,
can-
birdsell.ca, birdsell.ca. It's a full practice law firm, so if you need anything, then I'm sure we can find somebody to help you out.
Awesome, thanks. And how about you, Teresa? Any last words, and how can people connect with you?
Last words are thank you very much for having me. I think I already said that at the beginning, but this has been a great discussion. I really like the way that the conversation went. And, if you're a small business, that's what I do. I'm an HR consultant. I help small businesses gain confidence and knowledge in HR. So that's where I am. And I have a lot of discussions with a lot of my clients on this kind of thing, and we work through it together and we figure it out. So that's my biggest, that's I think what we're talking about a lot with my clients and my program members right now. That seems to be the hot topic. But yeah, and you can find me on at kiyahr.ca, KIYHR.ca. And I'm also the wonderful wizard of HR. So if you look me up on YouTube or Facebook or LinkedIn,
Instagram.
That's where you'll find me. Instagram, yeah, I'm on all the social media, not TikTok yet, but maybe one day. But that's where you can find me, wonderful wizard of HR.
Yeah, and I think small businesses out of everything are probably feeling the most lost in terms of guidance. Those private businesses, they are the ones at the forefront, as we talked about earlier, pushing through policies and procedures that make them feel safe, doing what they think is right. And I worry that a lot of staff members are at risk of abuse from clients. And who's going to protect them?
Yeah.
I worry about that.
Yeah. And I'm seeing a lot of that worry, and sadly, they're not getting the answers they need. I have some nonprofit clients as well, and they're really struggling because nobody really has any answers, right? And they don't want to be the trailblazers.
No,
they don't want to be the one who goes through that wall, like Sam said, right, and get all bloody. They're waiting to see what they can do, but they can only wait so long. Like a lot of them are folding under the pressure. They've been going with, in deficits to stay, and now they have these employee issues that they have to work with. It's really, really, really hard to watch for small businesses.
Yeah, I agree. Well, thank you for such a great discussion. Just hang on. We'll end the broadcast for those who are watching. I'll be coming back through and checking any comments that maybe didn't come through to us here on the live stream that are potentially sitting in YouTube world or LinkedIn world. And I don't know, Sam or Teresa, if you're active in those areas, but if you are, I'll tag you so you can comment on what they share.
Great. I'm just looking at the comments now. Gloria Miller, keep your pharma bribes. I wish I was getting paid by big pharma, but unfortunately I'm not. So I'm just looking at these now.
Oh,
yeah.
Yeah.
Sorry, I would have addressed that sooner. Anyway, I knew
I have nothing to do. Oh, and my disclaimer is, this is all just my personal opinion as well. Yeah. I'm not affiliated with anybody or anything. So
no, I appreciate the very respectful conversation we've had here tonight. Thanks, guys.
Yeah. Thanks, Tammy.
Thank you.